Have you noticed intimacy becoming uncomfortable since menopause? Maybe you've felt dryness, burning, or even pain that makes you hesitate to be close with your partner. You might have told yourself, this must just be part of aging, something I need to put up with. But here's the truth. Vaginal dryness and pain after menopause are not things you simply have to accept. They're incredibly common, affecting more than half of women after menopause, yet they're also highly treatable. By understanding why this happens and learning a few proven solutions, you can restore comfort, confidence, and closeness in your life. Hello, I'm Dr. Lisa Perriera. For over 30 years, I've helped women navigate the changes that come with menopause and beyond. I've seen firsthand how dryness and pain can affect not only your physical comfort, but also your sense of identity, your mood, and your relationships. And I want you to know, you are not alone, and there are answers. In today's video, I'll share 3 evidence-based secrets to reduce vaginal dryness and pain after menopause, so you can feel more at ease in your body and enjoy intimacy again without fear. Before we dive in, I'd love for you to subscribe to Elder Care Wellness, where we bring you clear, compassionate, evidence-based advice tailored for women over 50. If you've experienced dryness or pain yourself, I encourage you to share your story in the comments below. Your words might be the encouragement another woman needs to realize she's not the only one, and that help is available. So let's begin with the first key secret understanding why dryness and pain happen in the first place. After menopause, your body produces much less estrogen. Estrogen is the hormone that keeps vaginal tissues thick, elastic, and well lubricated. When it drops, those tissues become thinner, less flexible, and more fragile. Doctors call this genitourinary syndrome of menopause, or GSM for short. It can show up not just as dryness, but also itching, burning, and pain during intimacy. The important thing to remember is that GSM is not a sign of poor health or hygiene, it's simply a natural result of hormonal changes. And most importantly, it's something you can treat effectively. I once cared for a woman in her late 50s who told me she dreaded intimacy because the pain was so sharp it felt like sandpaper. She thought her marriage was falling apart because she no longer wanted to be close to her husband. After a simple exam and treatment plan, her symptoms improved dramatically within a few weeks. She later told me, I thought this was the end of intimacy for me, but now I feel like myself again. Stories like hers remind me how vital it is to talk openly about these issues. So as we move forward, remember this: vaginal dryness and pain after menopause are not the end of intimacy. They are simply challenges your body is presenting with solutions available to help you heal and thrive. In the next part, I'll share the first powerful step you can take to restore comfort, one that is simple, safe, and can make a real difference. The first secret to easing vaginal dryness and pain after menopause is to begin with gentle, consistent hydration of your vaginal tissues. Just as your skin becomes drier with age and benefits from daily moisturizers, your vaginal tissue also responds positively to regular care. Many women think lubricants are only for intimacy, but vaginal moisturizers are different. They're designed for everyday use. These products, which you can find at most pharmacies, work by holding moisture in the tissue and improving flexibility. When used a few times a week, they can reduce dryness, itching, and discomfort, even when you're not sexually active. According to the North American Menopause Society, these non-hormonal moisturizers are safe for nearly all women and often bring relief within weeks. During intimacy, lubricants play a separate but equally important role. They reduce friction, making intimacy more comfortable and often more enjoyable. Some women shy away from using lubricants because they worry it signals a problem or feels unnatural, but in reality, many couples of all ages use them. Think of lubricants not as a sign of weakness, but as a tool to support closeness and reduce pain. When intimacy is less painful, your body relaxes and you're able to enjoy the emotional and physical connection again. It's important to choose products that are specifically designed for vaginal use. Avoid lotions or oils not meant for this area, since they can irritate delicate tissue or even increase the risk of infection. Look for water-based or silicone-based lubricants without added fragrances or harsh chemicals. If you've ever experienced burning with certain products, switching to a gentler brand often solves the issue. Your pharmacist or gynecologist can also recommend options tailored to your needs. To help you picture the difference, I often use the analogy of a leather handbag. If you don't condition the leather regularly, it becomes stiff, cracked, and uncomfortable to use. But with regular care, the leather stays supple and lasts for years. Your vaginal tissue is much the same. Without estrogen, it loses flexibility, but with consistent hydration and the right support, it can regain softness and resilience. I once treated a woman in her 60s who had given up on intimacy for almost a year. She told me she felt embarrassed and disconnected from her partner. After introducing a routine of moisturizers and lubricants, she returned 3 months later with tears in her eyes, not from pain, but from joy. "I feel normal again," she said. "It's like someone gave me back a part of my life I thought was gone." Stories like hers show how even simple steps can restore both comfort and confidence. So the first secret is simple but powerful: moisturize regularly and use lubricants without hesitation. These tools are not about fixing something broken. They're about supporting a natural part of your body's journey after menopause. In the next part, I'll share the second secret one that involves targeted medical treatments that restore health to vaginal tissues from the inside out. The second secret to reducing vaginal dryness and pain after menopause is using targeted medical treatments that restore your body's natural balance. While moisturizers and lubricants provide comfort, they don't address the underlying cause, the loss of estrogen. Estrogen is the hormone that kept your vaginal tissue thick, elastic, and naturally lubricated for decades. After menopause, levels drop dramatically, and the tissue begins to thin and lose its ability to stay moist. This condition, known as genitourinary syndrome of menopause, is extremely common, but the good news is that medical science offers safe and effective ways to treat it. One of the most trusted options is low-dose vaginal estrogen therapy. Unlike hormone replacement therapy taken by mouth or patch, which affects your whole body, vaginal estrogen delivers a tiny amount of estrogen directly to the tissue that needs it most. It comes in the form of creams, small tablets, or flexible rings placed inside the vagina. Because the dose is low and works locally, the amount absorbed into your bloodstream is minimal. Studies from the Mayo Clinic and the North American Menopause Society confirm that vaginal estrogen is both safe and highly effective for most women, bringing relief within weeks. Patients often ask if using estrogen this way is risky. For the majority of women, the answer is no. Local estrogen does not significantly increase risks of breast cancer, blood clots, or heart disease the way systemic hormone therapy sometimes can. That said, every woman is unique, and your doctor will carefully review your health history before prescribing it. If you've had breast cancer or certain other conditions, your gynecologist may suggest alternatives such as non-hormonal medications like ospemifene, which mimic estrogen's positive effects on the vaginal tissue without being true estrogen. In recent years, other innovative treatments have also become available. Some clinics now offer laser therapy or radiofrequency treatments, which gently stimulate the vaginal tissue to thicken and produce more natural lubrication. While these procedures are newer and may not be covered by insurance, some women find them life-changing. As always, it's important to consult a gynecologist who specializes in menopause care before trying advanced therapies to make sure they're safe and right for you. I remember one of my patients, a retired teacher, who came to me saying, "I feel like my body betrayed me. Intimacy is painful, and I don't feel like myself anymore." We started her on a simple, low-dose estrogen cream. Within a month, she reported less dryness, and by her 3-month visit, she was smiling again. "I feel like a woman again," she told me. It wasn't just about intimacy, it was about regaining comfort in her daily life. So here's the takeaway: lies in the small choices you make every day, your lifestyle habits. While moisturizers and medical treatments address the physical changes directly, your overall health plays a powerful role in how well your tissues heal and how comfortable you feel. Think of it as tending a garden. You can water the plants and add fertilizer, but if the soil isn't healthy, the results won't last. By nourishing your body with the right habits, you create the healthiest foundation for your vaginal tissues to respond. One of the most important factors is staying sexually active or stimulating vaginal tissue regularly. This may sound surprising, but regular blood flow to the area keeps tissues healthier. Intercourse, use of vaginal dilators, or even self-stimulation all help increase circulation, which in turn supports elasticity and lubrication. Women who maintain some form of regular stimulation often find their symptoms less severe. It's not about performance, it's about keeping the tissue alive and responsive, much like exercising a muscle keeps it strong. Nutrition also plays a key role. A diet rich in omega-3 fatty acids from foods like salmon, flax seeds, and walnuts supports healthy cell membranes, which help your tissues stay supple. Hydration is equally important. Drinking enough water daily improves not only your skin, but also the hydration of your mucous membranes, including those in your vaginal tissues. Some women find phytoestrogen-rich foods like soy and legumes provide mild symptom relief, though research shows results vary. The key is balance, plenty of fruits. Vegetables, lean proteins, and whole grains create a strong foundation for your body to thrive after menopause. Exercise, especially aerobic activities like walking, swimming, or cycling, boosts circulation throughout your body, including your pelvic region. Yoga and pelvic floor exercises, such as Kegels, not only strengthen muscles, but can also enhance blood flow and sensitivity. These routines may seem unrelated to dryness, but they promote overall pelvic health, reduce discomfort, and improve confidence in your body. It's also important to avoid irritants that worsen dryness. Perfumed soaps, harsh bubble baths, and scented feminine products can strip away natural oils and inflame delicate tissue. Sticking with gentle, unscented cleansers and breathable cotton underwear can make a surprisingly big difference in comfort. And if you smoke, know that quitting is one of the best things you can do for your vaginal and overall health. Smoking decreases blood flow and accelerates tissue thinning, making dryness worse. I once worked with a woman in her 70s who told me she thought intimacy was over for her because of the pain. Alongside vaginal estrogen, she made small lifestyle changes, added omega-3 foods, started walking daily with friends, and used a gentle moisturizer consistently. Within a few months, she not only reported comfort returning, but also said she felt more energized and alive overall. She laughed and said, "I thought I was doing this for intimacy, but it gave me back my whole self." Every woman's journey through menopause is different, but your daily choices matter. Treatments can help, but your habits sustain the progress and make the improvements last. I'd love to hear from you. Have you found any lifestyle changes like diet or exercise that improved your comfort after menopause? Share your experiences in the comments. Your insight might be exactly what another woman needs to hear. In our final part, we'll bring together all 3 secrets, reflect on what they mean for your future, and remind you that comfort and confidence are not behind you. They are still very much within your reach. We've now explored 3 powerful secrets that can help you reduce vaginal dryness and pain after menopause, and it's time to bring everything together. The first secret was simple but essential: use moisturizers and lubricants regularly. Just as your skin needs daily care to stay soft, your vaginal tissues respond to consistent hydration. These products reduce discomfort in everyday life and make intimacy less painful, allowing you to enjoy closeness without fear. The second secret focused on medical treatments. When dryness and pain persist, despite moisturizers, low-dose vaginal estrogen or other targeted therapies can restore your body's natural balance. These treatments work directly where your tissues need it most often, with minimal risk, and can make a dramatic difference in both comfort and confidence. For some women, newer therapies like laser treatments may also be an option, offering hope when traditional solutions don't bring enough relief. The third secret reminded us that lifestyle matters. Daily choices, staying sexually active, exercising, nourishing your body with healthy foods, and avoiding irritants support your tissues and make other treatments more effective. These habits create a strong foundation for healing and help you feel more vibrant in every aspect of your life, not just intimacy. When you put these 3 secrets together, they form a roadmap back to comfort, connection, and self-assurance. Vaginal dryness and pain after menopause are common, but they are not something you need to accept in silence. With simple care, medical guidance, and supportive daily habits, you can restore ease in your body and joy in your relationships. I often tell my patients, menopause is not the end of your story, it's a new chapter. You have every right to feel comfortable in your own skin and to enjoy intimacy without pain. By listening to your body and taking proactive steps, you're giving yourself the gift of health, confidence, and closeness for years to come. Thank you for spending this time with me. If this video has helped you, please share it with a friend or loved one who may also be struggling with dryness or pain after menopause. Leave a comment with your experiences or questions. I'd love to hear from you, and your words may encourage another woman. And if you haven't already, subscribe to Elder Care Wellness, where we bring you trusted, compassionate guidance every week. Remember, you are not alone, and comfort is still very much within your reach.